Hey everyone, welcome. My name is Kweku. I'm a pharmacist. In today's brief video, I'm going to be reviewing the medication Farxiga. We're going to be diving into what it is used for. We will take a look at some side effects. We would also take a look at some precautions or some counseling tips that you should be aware of if you are taking Farxiga or if it has just been prescribed for you. Just wanted to mention that this review is for informational purposes only. It is not intended to be a substitute for medical advice from your physician. So please continue taking your medications as prescribed unless your doctor decides to change them. So first off, what is Farxiga? Well, Farxiga is an oral anti-diabetic medication. It belongs to a class of medications called SGLT2 inhibitors. It works by increasing the excretion of glucose from the urine, or in other words, it causes you to pee out excess glucose from the urine such that your blood concentration of glucose is lower, which is what we desire, what we want for people who have diabetes. With respect to the uses, the obvious one is, control of blood sugar together with diet and exercise, or controlling blood sugar together with diet and exercise. Two other not so obvious uses of Farxiga include the use of Farxiga in reducing the risk or the probability of being hospitalized if you have type 2 diabetes and you have heart failure, or you have a risk of developing heart failure. That Farxiga may be employed to reduce your chances of being hospitalized. Farxiga is also approved in people with straight up heart failure. That is when the heart is not strong enough to pump blood around the whole body. Farxiga may be used to, number one, minimize the risk of hospitalization in those people, or even minimize the risk of death in such people. Farxiga is quite effective at reducing or controlling blood sugars. If you look at this chart on your screen, you realize that over a 24-week period, Farxiga, when used alone, that is the middle chart, it was able to reduce A1C by about 1.5%. When it was used in combination with metformin, that A1C reduction actually was better at 2%. And then they compared it to just metformin alone at 1.4%. So you realize that Farxiga actually is good by itself at reducing A1C, but it even shines better when it is combined with other anti-diabetic medications, in this instance, metformin. One other modest benefit of using Farxiga is that it can cause a slight decrease in weight. As you look at this chart on your screen, you realize that over a 24-week period also, there was people who were taking Farxiga as monotherapy just by itself lost about 6 pounds, compared to on metformin alone, that is the one on your right hand side, they lost 3.1 pounds, versus the combination of Farxiga and metformin losing about 7.3 pounds. So in this instance also, you realize that combining Farxiga with another anti-diabetic medication like metformin actually causes some modest weight loss. I must put in here that Farxiga is actually not approved for weight loss. These are things that they observed during their clinical trials. So how is Farxiga taken? Well, Farxiga comes in primarily two strengths, 5 milligrams and 10 milligrams. For managing type 2 diabetes, your doctor will typically start you on 5 milligrams every day, usually in the morning. However, if that is not enough to bring your blood sugar levels to where your doctor desires, it may be increased to 10 milligrams daily in the morning, with or without food. It can be taken irrespective of if you've eaten or not. For the second category of people, heart failure patients, typically you will see 10 milligrams also taken once a day in the morning. As much as possible, try and take Farxiga around the same time every day just to maintain that consistency. Now, what are some potential side effects? Well, the first one is hypoglycemia, which is actually expected. That should tell you that at least the medication is working. But in some people, their blood sugar levels go too low and they become hypoglycemic. So what I'd recommend is have a plan. A lot of people will carry around glucose tablets and know the signs and symptoms of hypoglycemia such that when it occurs, you will know how to react to it. The second relatively common side effect is dehydration. A lot of people become dehydrated as they take Farxiga. This is because your urine volume increases slightly, so you're peeing out the sugar, you're peeing out some sodium, which in turn causes the body to become dehydrated. So the recommendation is, as you take Farxiga, make a conscious effort to be very well hydrated. Now, people who are most likely to become dehydrated while they take Farxiga are generally people over 65, people who are on a low salt diet, or people who have kidney issues. So if you fall into any of these categories, know that you're at a relatively higher risk of developing dehydration and take the appropriate precautions. Another relatively common side effect of Farxiga is vaginal yeast infections, which can occur because, as you're urinating a lot of glucose, it creates a conducive environment for some of these fungus to grow. So be aware of it and pay particular attention. If it does occur, let your doctor know for the appropriate steps to be taken for you. Urinary tract infections has also been reported, and this can occur in either men or women. It's not necessarily for women alone. So be on the lookout if there's any difficulty in passing urine, if there is any burning sensation on passing urine. That may be a sign of a urinary tract infection. So that is something that you want to take seriously. For some people, unfortunately, if not given the seriousness that it deserves, it may be serious and may require hospitalization in some people. So any changes in your urine habits should be taken into account and reported to your doctor for the appropriate actions to be taken on your behalf. Now on to some precautions that are worth taking into account. The first one is that Farxiga rarely but has been associated with a condition called ketoacidosis. Now, ketoacidosis is, in very simple terms, is a situation where there is a buildup of certain substances in your body called ketones. And this can be a serious condition and requires medical attention. So while taking Farxiga, if you notice any excessive tiredness, trouble breathing, nausea and vomiting, or usually pain in the stomach or in the abdominal area, these are generally signs that point to a possible situation of ketoacidosis, and therefore that is something that you need to take seriously and report to your doctor for the appropriate actions to be taken. Another precaution worth noting if you're taking Farxiga, or for that matter all the medications in that class, is a condition called Fournier's gangrene or necrotizing fasciitis, which in very simple terms is the destruction of the soft tissue. And this may usually occur around the perianal area, around the anal area. And so if you take Farxiga and you notice any kind of swelling, any kind of tenderness, or any kind of redness between the anus and the genitals, which is usually accompanied by feeling weak, by a fever, these are things that you need to be paying close attention to, and that is something that you need to report to your doctor right away. I must state here that Fournier's gangrene due to this class of medications is quite rare. It can happen, but it is very rare. In 2018, the FDA announced that over a 5-year period, they had only documented just 12 cases of Fournier's gangrene, which was attributed to that whole class, those SGLT2 class, not necessarily Farxiga alone. So you can see that it's quite rare, but unfortunately, if it does happen, it is something that is serious that requires usually hospitalization with some antibiotics, among others. So that's a high-level overview of Farxiga. I hope you found some value in it. If you did, please give this video a thumbs up. Subscribe to the channel if you have not already done so, and I will catch you on the next video. Thank you.